Welcome everybody to our next edition of our Spinal Workshop series. I'm your host, Dr. Ryan Weaver, here at Apex Spinal Performance. Today's Spinal Workshop, we're actually going to be talking about what we call half hour to health. We've really condensed this and pressed this down, which we probably need to edit the title of this. It should only take us anywhere from 10 to 15 minutes. But really, the topic, half hour to health is diving into some of the basic foundations of what we do here at Apex. And a half hour to health is the most important aspect of our body, from when it was created to what operates, the command center, if you will, of our body, and diving into that and looking at what I would consider really basic things that's universal to all of us, but most of the time we really don't understand much about it. So before we go into this topic, we have our YouTube channel now. We're on Facebook as well. Subscribe to us, like these posts. That way that you can see our updated announcements and spinal workshops that are done every Tuesday. We go live on these or post these on Tuesday around 6:30 p.m. And we do this every single Tuesday. Next week's topic is going to be nutrition. The week after that, this is going to be the first time we've ever done one of these. It's called Open Mic. Dr. Helms and I are going to really look back over the month in our office. Are there any wild and crazy things that we've heard or see that we've helped improve, or things that are kind of mainstream in social media, and what we can do to potentially benefit from those with chiropractic care. So in 2022, one of our headlines was and our mission is continue to educate our community. And we base that off of the #1 cause of death in our country is poorly made choices. You're going to hear that throughout the rest of the year from us. That was a Duke University study that found, oftentimes we just make bad decisions. And we don't want that to be in our community from a lack of education and knowledge. And I tell this to my patients, we're going to continue to give you information and education because I want you to feel empowered. Whether you go to a different healthcare provider, whether you're here in the office, I want you to feel empowered to ask questions and not just accept, okay, here's a pill for this or surgery for that, and that is the only solution. But again, we oftentimes go through this, and we just had a patient the other day who mentioned, the best thing that was given to me was here's a painkiller, a steroid, and a muscle relaxer, and after that, if that doesn't work, well, you're kind of upstream without a paddle. We don't know what else to do. To me, that's not an acceptable answer. So let's go ahead and dive into this. In half hour to health, so you heard me mention one of the basic things. Forgive my artistic ability here. I'm not an artist or Bob Ross, but we'll dive into the command center of our body. And it's one of the very, 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 very first things to be developed in a woman's belly, which is our nervous system. Okay, this is not an ice cream cone. Think of this as your brain and your spinal cord down through there. So your central nervous system, your CNS. This consists, again, of our brain and our spinal cord. It's one of the first things develops in mom's womb. That happens about 2 weeks. And for the next 8.5 months, things start growing off of that. That's referenced as your nodal cord at that time. So thinking of our nervous system, our spinal nervous system, we have information all the time that is coming in and out. Brain talking to body, body talking to brain. What's our atmosphere? Is there pressure against us? Is it hot? Is it cold? Are we hungry? All of these things. This is a very, 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 very delicate organ system. I bring up Superman, old school Superman, Christopher Reeves, who became a quadriplegic because he injured this. When you think of traumatic injuries to the brain or spinal cord, it's always a very severe thing. Even in CPR and first aid, unless there's a fire or something emergent around the individual who's injured, you really don't move them because typically the biggest fear is injuring their brain and spinal cord. So this, again, is a very delicate thing, and in a moment I'm going to bring out the spine model here, which we'll go ahead and do that. And when you look at how this brain and nervous system and spinal cord and all the vertebrae around it were created, our brain and spinal cord are the only thing that are totally, fully encapsulated in bone. And per cubic inch, bone is the strongest substance. Again, God made a really, really, really good system. There's a way that it was designed. There's a reason, that it was designed that way. You know, our kidneys are super exposed. You know, there's not much protection around them. And even, you know, your liver, your lungs, your heart, all of your internal organs. Yes, your rib cage is over that, but relatively speaking, in comparison to your vertebral column, it's very easy to injure. So, with our spine, there's a lot of movable segments here, okay? It means we have great flexibility. You know, we can bend down and pick things up off the ground. We can bend all the way back behind us and pick things up that are, you know, in a vehicle rolling around on the floorboard. Maybe that's just me, but there's usually a bottle of water running around somewhere back there. So when we look at this, it's very easily injured. A lot of flexibility, it's easier to injure. Very stiff and hard, not much flexibility, harder to injure, right? So on this model, you see all these yellow things here called your spinal nerve roots. You know, and when those get pushed on or pinched in an abnormal way, we call that in chiropractic a subluxation. And all my patients know that. We have them really hone in on what is a subluxation. Now, the medical community back in the day didn't think that that was a real thing. But really the evidence came from the medical community. A Dr. Sue at the University of Colorado said this whole subluxation thing, there was no scientific evidence and it wasn't a real thing. And actually what he found was the pressure or the weight of a dime on a nerve, okay, for just 5 minutes can shut that nerve flow down. Again, back here, as I said, brain to spinal cord and then down through the rest of our body. That is a network of electricity, communication cables, however you want to look at that. And if that's occluded or slowed by 60%, upwards of that, then maybe things aren't getting the proper information. And my challenge to you is to think that, well, that's only 5 minutes. What happens 5 months, 5 years, if something has been pressed on for that long? Okay? Now, we talk about disease a lot, which we're going to jump down to that. All right? We've heard and have heard of this all too often in health. Well, typically that starts off first, I'm going to abbreviate here, with a dysfunction. So a dysfunction, a lack of, and I quote, a state of balance and coordination in the body can lead to this. Again, put in the factor of time, months, years later, and we break down this word. Dis-ease. Now again, I'm sure you've already started connecting, the dots of how this flows and gets down to what we know as disease. But just breaking this down. Our body always wants to be at a state of ease. Again, you heard me mention earlier, are we hungry, are we cold, are we hot, are we sweating, are we shivering? Your body is monitoring the outside environment, and it creates a reaction because, again, it wants to be at ease. So, lastly, as we said, that will eventually work its way to disease, which we most commonly associate in healthcare. It usually takes years to get to this point, and now we have a whole lot of symptoms. And sadly enough, in our healthcare system, we base things off of, well, do you have a symptom or you do not? When I meet patients awfully for the first time is, I hope and tell them that one day patients seek out care or what we do before there's a symptom or a disease, because we know it's easier to take care of things before it even becomes a dysfunction. It's a lot harder, more expensive, longer to deal with as a disease. So we need to start being proactive and preventative. And how can checking your spine help with that? Well, we know, again, that's the master system, the command center to everything. I believe it was our last spinal workshop that we referenced that. And when we also referenced, what's the definition of health? Well, if you just Google this in, Webster's dictionary, the state of being free from illness or injury. So when you look at that, how about this definition? I gotta say, the World Health Organization actually put a lot more thought into this, is a state of complete physical, mental, and social well-being, and not merely the absence of disease and or physical, mental weakness. So back to this, if we started dealing with things before it became an issue and we actually put value into our health, not waiting till symptoms arise, that would be much easier to deal with. Healthcare would cost less. And again, well, what does insurance cover? I get that question a lot. Well, what they should cover are healthy food selections and gym memberships at minimum. And yoga and everything else, I group into that as well. You should be rewarded for investing in your health rather than waiting for something bad to happen. Now it costs tens of thousands of dollars. So again, I bring these up to provoke you of thinking differently. We reference this in the offices. Well, we brush our teeth, hopefully, at least once a day, maybe multiple times. Maybe you floss, Listerine, maybe you had braces, a lot of those things that we value, right? I see your teeth, you see mine, there's some vanity to that. But when you look at, well, what have you had your spine checked? Even the most wellness visits to the primary physicians, you usually don't check those things. But there's a lot that happens with that. This system, your nervous system, operates and controls everything. So we should have that checked. That should be a regular thing that we have checked. So I've heard stories of patients, even in my own life, of family members or friends who were quote unquote healthy. They had no symptoms. And when you hear some of these stories, and maybe you can relate if you're watching this, that they went to a wellness check, everything was deemed fine, and maybe a week later they died of a heart attack or some other symptom, or some other disease. Just because you don't have a symptom doesn't mean that there is something going on. We have to constantly be proactive. So my challenge to you is have your spine checked, okay? Is look at this as a whole. Your nervous system, your brain and spinal cord totally command and control every single other organ in your body. I bring this up. There's so many things that are important to us. Nutrition is super important to us, which we're going to get into next week. Exercise, sleep, all of these things. If you looked at all this, food, nutrition, super important. But at the end of the day, you could go months without food. Sleep is important. At some point, you have to sleep. The record that I noticed and found, researched, was 11 days. I believe it was 264 hours. Now, after 48 hours, cognitive dysfunction starts happening already. Water, you can go about 3 days without. Okay. Oxygen, 4 minutes, and you start noticing brain damage to that and other organ systems. But the number one thing that if it's injured, it's typically at that single moment in time that's really hard to ever reverse, is damage to a nerve or your spine. So we need to start valuing this, what we have, way, way earlier. And the more that I see, the more of us that work from home or at a desk job, and even kids, yes, poor posture, yes, I'm going to be, that healthcare provider that brings up poor posture, that starts damaging early on, our cervical spine. Okay, and if you look at all the important things up here, your brain stem sets up there as well. So my challenge to you is, in call to action, is have your spine checked. We did that in 6th grade. One time you bent down, touched your toes to see if you had scoliosis. And it really has to be pretty bad to see it that way. But after that, we never check it again. Most commonly, there's always exceptions. So have your spine checked. Tune in to next Tuesday. We're going to be talking about nutrition. Dr. Dr. Helms is going to be on there with me. And, that's something that he really prides himself on, his nutrition as well. So we look forward to seeing you at our next spinal workshop about nutrition. And again, have a blessed day. Again, we want you to live your best life and be empowered. So thank you for tuning in, and we'll see you next time.